Okay, so let's just jump right in today's session. So what we're going to see is ethics in healthcare, overview and content. Everybody can see this all right? Good. So we're going to talk a little bit more about ethical models, but this time we're going to focus on the patient and the physician relationship. And then we're going to think about how that plays out in an organizational and business ethic. And I was talking earlier about how organizations, whether they are motivate staff through punitive or through consequence, or motivate on the basis of reward. And we're going to look at understanding ethical models and how they impact our ability to make decisions, and how why organizations are impacted by So let's think about some of the models of ethical behavior. So there's a model that is called paternalistic. We'll talk about this in a minute. There's an agency model, contractual model, friendship model, and fiduciary model. Now again, the terms themselves are important, but the concepts are probably more important. You'll hear paternalistic. Agency and contractual and friendship, they get placed. Fiduciary, you see the trust model, that you see different terms, but let's look at them from the idea of what are the benefits and the limitations of each approach. And I think the most important thing to say is that the models that you see here, there isn't one that's quote unquote better than the others or universally applied than the others. But there are ones that I think are more appropriate to given circumstances than others. Let's look at the paternalistic model. Paternalistic is, think of the word as father knows best. Think of it as this idea that the authority, the person in the power seat ought to know more and ought to be respected and listened to. In some countries that adopt a more authoritarian approach, a little bit more hierarchical structure, tend to like the paternalistic model. There's this level and there's this level, and this level is more serious than this level. Now, in the paternalistic model, the doctor or the dentist or the nurse, and so if I say the word doctor, I want you to also understand that it applies to a variety of healthcare professionals, but I'll use the term doctor because that's where it's most applied. But they're the technical expert and the final decision maker. And they're taught to blend firmness with kindness. Father knows best. I'm telling you, this is what you need to do, and you will do it because you're dutiful. Now, the doctor is responsible for doing what's in the patient's best interest, but because they have a superior technical knowledge of the clinical needs, it's assumed that they know what's in their best interest more than what the patient knows. So what do you think the benefits or the limitations of this are? Who wants to sort of jump in and give me a benefit? We talked about in the past how, that there's a lot of times that physicians will be sitting in their office and somebody will come in and say, oh, doctor, I need this, this, and this. And the doctor will say, no, I don't think that's the case. There are some people who are so scared and afraid of going to the doctor that sometimes they need somebody to hold their hand and just to help them go forward. The limitations of this approach is we saw it in a video a couple of weeks ago where we looked at people women in particular, who had a lump and they went under general anesthetic, and depending on what the physician felt was in their best interest, they either woke up with the lump taken out or the breast removed. So there was no consultation beforehand. And that was the mastectomy versus the lumpectomy discussions. Or when there was this effort to try to look at to see whether or not a lumpectomy had value, physicians refused to refer people to that study because they felt that the study was wrong, because it went against what their technical knowledge was for at the time. So paternalism does have its values. It really does. But also at the same time, it can be overused and abused. So the firmness of kindness, a physician says you need to take this vaccine. It's in your best interest. But people are not going to do it until they really feel the risk. Is this in the patient's best interest? The doctor says to the patient, of course your operation is absolutely necessary. Without it, I don't get a summer vacation. So we'll talk about this going forward, but physicians are compensated for what they do. They're rarely ever paid in a fee-for-service world for things they don't do. So physicians at the same time have also been trained that when they do an intervention that doesn't work, they escalate and escalate and escalate. They're trained to escalate. It's not common for people to be trained to de-escalate. And when you're dealing with end-of-life decisions, how do you withdraw services that may give you an extra week, but may give you an extra month, maybe extra 6 months, but will really cause you great pain and discomfort during that time? So let's look at sort of the opposite, which is called the agency model. You ever heard of this? It's sort of the opposite of the model of patient and physician relationship. And the physician is the technical expert who does what the patient asks them to do. We saw the video a couple weeks ago where the dentist was saying, a patient who had, perfectly fine teeth said to come in and said, remove all my teeth. Under the agency model, the physician would do it. They're a technician. So you see some examples of extreme cosmetic surgery or prescribing drugs or doing what the patient or mother and father wants. I'll give you an example of, for those of you who know the artist named Michael Jackson, the music person. He had trouble sleeping and just difficulties in general. And so he hired a physician who used an anesthetic, propranolol, to administer to him every night to sleep. And having undergone a procedure where I was given that thing, man, you're just knocked right out. And so I do understand that it works. But this physician was giving it to him, giving it to Michael Jackson in his hotel room without proper supervision. And in theory, Michael Jackson died as a result of it. And the argument is the physician ought not to have done that. The physician was acting out of scope. The physician was doing, but the physician was arguing as I was just doing as my patient required. And if I didn't do it, the person would go and pursue it somewhere else. So to some degree, even this, when you think about the opioid addictions, or if you look at the people who are drug seeking and they set up safe injection sites, it doesn't mean that you condone the person's drug use. It's just the fact that you create a way in which the person can do it safely. So that's more of an agency-based model. So I've sort of given you an example of some of the limitations and the benefits of this. But also think about it from the perspective of, if the mom or the dad override the wishes of the child and ask the physician to do what the mother and father says, even though the child is not in agreement with it, then in theory, that's an agency model where the physician just listens to what the mother and father want. The physician's personal values and stuff don't come into play. Let's look at a next model, the contractual model. It's similar to the agency model, where the patient comes into the doctor and says, I'd like this, this, and this, and the physician can either determine whether they want to do it or not. So think of it as a service for hire. So going back onto that, the dentist that, decided not to remove the person's teeth. Yeah, you could do it, but not interested in it. The physician who was asked by Michael Jackson to administer a sleeping agent, the physician could have said no. But the physician agreed to the contract. There was no force or coercion implied. Physician, in this model, the patient asks for the service and the physician decides whether or not to do it. Now, it also works in reverse, which is if a person comes to the patient and says, will you do this for free? And the doctor says, no, I'm a businessman, I'm a businesswoman, I'm going to get paid for this. So they are required to perform emergency care, but they can refuse to treat if they don't like the terms. And one of the terms could be, I'm not going to pay you. So you could be a dentist working in a clinic in India, and in the government clinic, it could be, 25 rupees to do a procedure. But that same clinic will never even look at the patient unless it's 1,000 rupees. So that's a contractual model where the physician determines whether or not the terms are acceptable. So doctor-patient interaction. Do you want to know what's wrong with you or just the dollar amount? So is that a contract? This one I like. The dentist has just pulled a really, really, really long tooth, and the patient is obviously reacting to it, and the dentist says, I'll have to charge extra for that one. Any questions so far?
No, Professor.
Let's look at the friendship model. The friendship model is like the paternalistic model, except the physician is soon to be taking a personal interest in the welfare of the patient. Okay. And the physician, rather than being kind of neutral, jumps in. Says, this is really in your best interest, et cetera, et cetera. Or this is not in your best interest. This is not something I would recommend to a friend. And you've heard some people say, if this were your mother, this was your father, this was your child, what would you do? And that's a friendship type discussion, because they're using the emotional bond between the parties to influence the patient decision. Now, that doesn't in any way mean that the physician is wrong to use it. Nowhere am I saying that the physician is wrong to use this. But I'm just giving you examples of how the healthcare system works in terms of different type of models. And it also works on the other side, which is, the patients come to the doctor and says, yeah, I know, but can you help me out? A couple extra pain pills. I missed work for a couple days, and because I just didn't want to go. My boss is a real jerk, but I now need a note. Can you just give me a note? Can you help me out? I'm appealing to your friend, your human quality, as opposed to your professional ethic. Can you help me out of this jam? but it also means the physician can withhold or emphasize information. And that, again, places the physician in a, in a, in a position of power and influence. And they talk about how in the mental health world, where the therapist is in a therapeutic relationship, that people will naturally see them as being vested in them on a personal level. And sometimes that personal level, that transference, forms an attraction of sorts. This person really cares about me, so therefore they must really like me. So you can see how the problems play out. And lastly is something called the fiduciary model. And again, fiduciary, we've seen that word before. It sort of means trust. And let's sort of think about it. So it begins with this idea that the doctor and the patient are equals. They're co-equals. And it begins with this idea that there's trust between the two of them. The patient will be fully truthful to the doctor, and the doctor will always act in the patient's best interest. So here the doctor is the technical expert, and they have values and rights. And this includes not accepting certain things. And the model understands that there is the power differential, but treats the patient values as the determining factor. In other words, it's not at the end of the day like in the paternalistic model where the physician will have the ultimate authority, but it's more like the patient has the ultimate authority. So when you've thought about these different models, what do you think? What model seems to stand out for you to be something that's really good? So let's think about in the agency model. Somebody says, I'm really worried about developing breast cancer. So I go to the surgeon and I say, give me a double mastectomy, please. Or they go to their physician and they say, listen, I'm wanted by the police for crimes that I've committed. I need you to alter my appearance in terms of cosmetic surgery so that I'm unrecognizable. And there are physicians and others who will do that. The contractual model, again, if you think about it, in the United States, the president of the United States, previous president, Mr. Trump, many years ago, there was a president who had polio and had certain health conditions that they kept hidden. And so they passed a law that said you can't hide your health conditions because it matters. And so every year the president is supposed to release an update on their health. But of course, people say that violates their privacy, et cetera, et cetera. So what the president did was he found a doctor and he dictated a letter to the doctor, and the doctor signed it as if it was medically right. And he said that Donald Trump is the most healthiest 78-year-old person that he's ever seen. And it's just weird, right? So that's a contractual model. These are real things. So you think about the friendship model, and you think about the way in which people have challenges. Now, can a physician treat their own children? No, because there's something emotional about how they're connected to their children. And they can't treat their partner or their spouse. Now let's see.
No.
What's that? Go ahead.
They cannot treat their spouse or their children because of emotional attachment.
Yeah, because it's considered that they're not able to. Well, anyway, the point of it that the friendship model, we all know, however, that we've got friends that are doctors, or we think our doctor will help us out with a certain thing. You know, it's not uncommon. Here's a sort of an example of the last example I'll use is the fiduciary model. If you guys can give me any examples of where you think this is good or not so good. And I'll give you, well, maybe I'll jump in as you're thinking about something, but say, for example, a woman appears to a doctor's office and says, I'd like an abortion because I've found out that I'm having a child that is going to be a girl, and I don't want a girl. And for the purposes of sex selection. And say this physician is somebody who performs abortion. So under the contractual model or under the agency model, what would they decide to do? But under the fiduciary model, if the doctor does not believe this is a medically reason, in other words, the pregnancy is not being terminated for medical reasons, in other words, that the mother's health is not at jeopardy. I'm not going to give you a prescription for opioids because I think you're drug seeking and that you're being deceitful, that you're claiming to have a bad back or a sore leg, but I don't think it's the case. I'm not going to sign your disability claim because I don't believe a person with depression is permanently disabled. Now, I ran a National Center for Depression and Anxiety, and depression and mental health is as serious as cancer and heart disease and stuff, and it's life-ending for some. So the fact that people don't believe that depression is a permanent disability, and these are psychiatrists, I know them personally, is interesting because a lot of radio programs right now, and there's a lot of lawyers who are making a lot of money right now in fighting against insurance companies who claim that people who have depression or anxiety are not disabled. And you see it as a physician who'll say, I encourage you, if you're not comfortable with what I'm recommending for treatment, I will give you an opportunity to go get a second opinion. Steve Jobs, the famous computer guy, when he developed his liver cancer, pancreatic cancer, he was adamant that as soon as you cut open the body and you expose the internal body to the air, the oxygen and stuff, that it's really bad for you. So for a year and a bit, he did not accept the doctor's recommendation that he needs to have surgery. He thought he couldn't treat it with a macrobiotic diet. He thought he would eat certain things. He just was somebody who believed that this surgery was too invasive. And lastly, remember in our law course, we talked about assisted death, MADA. And whether a physician has an obligation to assist in a person's death or not. So then why do these models matter? Why do you think they matter? If you were to look at one of these models and say, I like this model more than the other model. What one appeals to you most? Is my camera working? Is my video on? Hello, hello.
Yes, Professor.
I'm curious by why people are a little reluctant to talk. What's going on? Is this information, is it overwhelming, or is it too simple, or what's people, are they tired? So what if you went to your physician or your dentist, which model do you would hope that they would practice?
The medical model?
The medical model? Yep, absolutely. But which one of the medical models? The paternalistic, the agency, the contractual, the friendship, or the fiduciary?
Maybe depends on the person, like if someone friends or like
If
what we
it's a
look
family
like
doctor,
depends on.
Okay.
yes. Also, if it's a family doctor, I think it'll be more of a friendship model, maybe,
Okay.
if we've known each other for years.
So friendship model for a general practitioner, but okay. So if it was a specialist that you didn't know, what would you like them to do? To what kind of model?
Then it would probably be a contractual model.
Okay. Contractual model, all right. Why a contractual model? Why do you think the contractual model, why do you think it's better, or why do you think it would be practiced more? The I've had an opportunity to teach medical students at McMaster in other places, but one of the things that I guess it's becoming more common is for people to look at the fiduciary model, the idea that the basis of trust. And one of the reasons why the trust model is important is because in a contractual model, both people are capable of knowing what they want.
Okay.
But when you are faced at a healthcare problem, you don't always know what you want. Like, for example, if you go into the doctor's office and you have a sore back, and you say, I'd like a painkiller because my back is sore.
Okay.
A doctor could say, well, we need to know why your back is sore. Is it a muscle problem? Is it a spinal problem? Do you have pain in your kidneys? Like, why? So if it's a simple situation where the patient comes in and asks for, the physician then makes a decision as to say, yes, I will agree with it. It implies that both the physician and the patient, especially the patient, is fully aware of what they need. That's in their best interest.
Okay.
But contractual model is a good model. But it's not that much different than a paternalistic model either, right? It's like the patient comes in and says, doc, got a sore back, I don't know why. And then the doctor says, okay, I think this is the problem that you need to address.
Yes.
Let me give you a real example. So in Hamilton, there was a situation where a young First Nations girl, I think 11 years old, had cancer. And the cancer that the person had is treated through chemotherapy. And the physicians recommended chemotherapy to help this girl. And the parents, who were First Nations just outside of Hamilton, said, no, we're going to take the child back and use traditional methods. The evidence of the use of traditional medicine wasn't really clear to the physicians. So they thought that the choice of going towards an unproven or less proven practice was not in the patient's best interest. And more to the point, they felt that the parents of the child were not acting in the child's best interest. So they petitioned the court to take conservatorship over the child. In other words, to remove the parents' influence over the final say of the decision. So what if, for example, a child was brought to a hospital and there was a standard treatment available and the parents decided that they don't want it? Instead, they're going to go home and they're going to pray. And that's how the disease is going to go away. What do you think about that situation?
There's nothing we can do about it for that matter, because it's upon the it's also the patient's decision.
Ruby, I absolutely appreciate your participation on that. And you're right, it is the patient's decision. But what if I, as a physician, determined that you as a patient aren't capable of making a good decision?
Then maybe it will help patient to restore his health.
So, I mean, the doctrine of emergency care is that if you come into my hospital and you are sick and somewhat unconscious, you can't give consent. I mean, I'm not going to, if you are dying and lost consciousness, I'm not going to revive you to ask if I can do the procedures. Right? So to some degree, there is a paternalism that's in place. Right? And this is the point that I'm trying to make here, is the fact that these healthcare models are in place because there's really good reasons for it, and there's challenges against it. The one model that seems to be, again, I circle back on this, the one model that seems to be embraced as being reasonable is the fiduciary model. It's the model that's based on trust. Because the trust has elements of all of them together, right? If you trust that your doctor is the technical expert and that you will accept what they say, but at the same time, you know, if you are a patient and you're coming into the doctor and you're being not truthful, then under a contractual model, you can demand that the doctor do something that you don't think is in the best interest. So the fiduciary model, the model built on trust, is the model that seems to be emerging as the one that is the most supportable through evidence and through ethics. So there's not, you know, in theory, you can argue, well, but sure, but the fiduciary model is contractual, right? In other words, the patient says to the doctor, this is what's wrong with me, what do you think? And the doctor says, well, based on what I see, I'd like you to go to do this, will you accept it? And the patient says yes. So there's a contract, and then the physician does it and the patient pays. So, I mean, in the fiduciary model, there isn't exclusion of the friendship model, there's an exclusion of the contractual model, but there's just this idea that both come fully formed and able to make decisions. Because again, patients are not always truthful. And the doctor has to have that truth in order to treat somebody as best as they can. And so this idea of fidelity or truth seems to be a bit of a recurring theme, doesn't it? So let me just I'm going to share my screen, and then we're going to take a break. What we're going to do is we're going to share, where are we here? We're going to see a short video. And the video is called Medical Errors, the Silent Killer in Medicine. Okay? And it's going to talk a little bit about why these models are important for us to understand. So before the break, we talked and we saw the video about talking about the question of medical error. And the reason I introduced it was this idea of when you think about an ethical model of behavior, when you think about ethics going forward, ultimately your job as a clinician is to be trustworthy and truthful. But is that similar to the way in which we look at things with respect to when we're administrators or in positions of leadership? And so I'm going to show you another video that's going to be from a gentleman by the name of Simon Sinek. You've seen him before. And he's going to talk about the issue of trust. And I want you to sort of to embrace the ideas of it, and then we'll talk a little bit more about what it means to be trustworthy in a leadership role. So hopefully you can see Mr. Simic. Okay.
There's a man by the name of Captain William Swenson who
Yeah, it's good, isn't it? So let's think about this.
It's
Go ahead. Go ahead, Rajat.
yes, Professor, it's good.
So let's think about now in terms of an organization. We've seen that what's trust? So if you believe that the government is out to get you, if you believe that the medical community is out to get you, if you believe that the vaccines of the world are out to harm you, it's a symbol of a lack of trust. And to make the leap of faith, to trust that science is out there to do what's in your best interest, means that you're more likely to accept the responsibility. Now you can punish, you can reward, but this is the interesting part about how do people react when they are in a trustworthy environment versus how do they react not in a trustworthy environment. And even when you think about the physician models, you think about the fiduciary model, which is primarily based on trust, which is the physician is going to be truthful to you and tell you what they know and what they don't know. And the patient in return, because they feel it's in a safe environment, will also disclose. We'll let them know exactly what's going on. And I think when you have two people that are willing to have that trust, then suddenly you have transparency and you have accountability. And the same thing goes when you're looking at an organization. So transparency and accountability, you know, you can sort of say, what does success and failure look like in terms of your personal life or your professional life or in terms of your employers or your employer? I think Simon Sinek sort of talks a little bit about what does trust look like. So what does failure look like in terms of your professional life? What do you think, what have you seen in the past that sort of erodes your trust? So if you're in an organization and let's say, for example, you were doing your dental residency or you were doing a clinical residency and you saw physicians cutting corners, you saw dentists cutting corners, you saw, and then when somebody raised an objection, the person who raised the objection was ostracized. It's a trust issue, isn't it? If you raise your hand in the middle of a class and say so-and-so is cheating, right? You know what'll happen. You'll no longer be part of the safe circle. You're now going to be kicked out. And you don't want to be ostracized because being in the safe circle is safe. Trust is hard. And trust and accountability is even harder. One of the things that is, you know, I was going to say a bigger word, but one of the things that really complicates healthcare is the fact that when a medical error occurs, do you disclose it? And hospitals have medical ethics boards specifically to deal with questions of what do we tell the patient. And I know that there is a lot of, you know, lawyers will say, well, you can't disclose, you can't even apologize. But when you don't have, when you don't have that level of interaction, is that you erode accountability and trust. If you worked for an organization where somebody made an error and the physician sat with you and said, this is the error, and you were a nurse or a technician and you watched the exchange of truth, you would kind of feel more aligned with the person who is talking the truth. And you yourself would feel, yes, I can recommend this organization because this organization is truthful. You can look at any organization or any family for that matter, where there is a lack of trust and then there was full trust. And how does it make you feel? Probably makes you feel a little different. This is an article about privacy that I'll let you read on your own. So let's think about the business of healthcare. And we think about its mission, visions, and values. It's not something that is simply just written on a piece of paper. It matters. And so if you think about the medical models of paternalism, agency, friendship, contract, fiduciary, what model should an organization adopt? In chapter 9 of the text, although it's not assigned, there's a really good synopsis of some of the ethical issues around organizations and business. We'll talk about these more when we meet again after the break, the Success Week break. But when you think about business and organizational ethics, what Simon Sinek was talking about is, you know, what do you do if you're a CEO, if you run a long-term care organization, and you're rewarded for the money that you save or the corners that you are able to cut because of it, what does it say about the organization as a whole? When you look at the people that have had massive COVID outbreaks, and you look at the organizational culture when it comes to being truthful and open in terms of allocating resources, you're going to find that organizations that didn't do as well in terms of COVID challenges. And I guarantee you that one of the things that was most prominent was the lack of loyalty, the lack of trust, and the lack of transparency. So what does this mean as a healthcare administration? It means you've got to let people know what the situation is, not to the point where you, again, you can sort of argue, is it a friendship model? You have to mirror accountability and trust so that people know what's what. And that means you have to manage your funds, but to ensure the staffing levels are safe. So if an organization, if you're working on a shift and you know that when somebody calls in sick, the organization will not replace because they're trying to save money, the people who are remaining in place, who are working, will be worked extra hard, and they'll do two things. They'll be mad at the staff member for calling in sick, but they'll be more angry with the organization that doesn't fill, because the organization is basically saying, I don't care. So how do you keep staff happy? What does it mean to be happy at work? I think what Simon Sinek was trying to tell us is what matters at work is that we feel to some degree safe. Doesn't mean, go ahead. Go ahead, sorry.
Yes, Professor. It means there is trust for the leader, and we feel safe.
Yeah. It doesn't mean that it's not hard. It doesn't mean that you're not accountable, and it doesn't mean that you are not expected to perform and produce.
No, Professor.
But it means that you will be supported in your pursuits. So what is happy at work? You know, I used to say to people, well, you know, a lot of people say, well, you know, I'm not happy at work. And I'm thinking, well, what is it about work that you don't like? And well, you make me do stuff I don't want to do. And I say, well, but they pay you for it. If it were all fun and games, then you can volunteer, right? So work in and of itself is you are exchanging it on a contractual model. You are saying, I am coming here to do a function. It's not me as a person, it's me as a function. But when you create a safe and trustworthy organization, I feel safe enough to give myself a little bit more than the minimum, because I know I'm not going to be harmed. So Ruby, thank you for letting me know what happy is. Yeah, happy to some degree is safe. And I don't mean safe that you can put your feet up on the desk and you don't have to do any work, or you don't have to show up. But you're going to be treated with respect. You're going to be treated predictably. And you're not going to be, somebody's not going to stand there and just kind of give you grief because they feel that that's motivating to you. Ultimately, 2.8 million people in India made the decision to go and get vaccinated because they trusted that this was the right approach, both for themselves, for their family members, but also for their community and their country. In Pakistan, when they decided that they were going to punish those who don't go, that kind of erodes the trust. And you'll see right now in the US, when you see people who are anti-maskers, people who are anti-vaxxers, they're angry. And the things that they say and the way that they say it implies that they don't trust. And is that wrong? No, but that's how you look at organizational culture. And so for many of you, they're out looking for jobs and looking for work. And you think, it's really hard to get into jobs and work. Well, it's because a lot of jobs are not available because the organizations that have those jobs treat employees really well, and employees aren't really interested in leaving. So there's a difference, again, there's a difference between getting a job and getting the job where you get to be happy at work. And those jobs where you're happy at work will likely nearly 90% of the time will have a culture that aligns with your values. And so healthcare is a commodity, which means that I go to the doctor's office and the doctor expects to be paid for the work that they do. And I'm okay with it. And as a healthcare administrator, I'm going to charge you for the work that you do, even though you may not have a lot of money. I'm going to charge you for it. Because it's a business. But people say, well, wait a minute now, wasn't healthcare a right? Shouldn't you sort of take advantage? So one of the things that we as a society ought to do is to take care of people. As a matter of fact, you know, what made you decide to go into healthcare in the first place? Is because you agreed that they're helping others is a nice thing to do? Or did you say, you know what, if I'm a dentist or a doctor or a pharmacist, I can make some good coin. It's all about making some money. So health is a commodity, as health is a right. And then you ask the question that we have fundamentally in Canada, because again, we have a mix of public and private. We have public insurance, but private healthcare. And at least 30% of all the money that's spent in Canada is done privately. And it's for profit. People are making money off this. So whenever you hear people say, oh, government cutbacks, well, the government has not cut back. Every year, the amount of money they put into the budget for healthcare goes up. It doesn't go back. But ultimately, you hear the people saying, well, there should be more government participation in this. There should be less private participation in that. In long-term care is a great example, because 60 to 70% of the beds that are in our long-term care system are for profit. They're private. So is healthcare a right? I don't know. Giving you a safe place to live, is that my responsibility as a government? It's a good question. How much should I charge you to live in a long-term care facility? I can certainly provide your nursing care 4 hours a day, but what else do I have to provide? Do I have to provide you a living accommodation that's, you know, gold-plated? Should I provide you a place where you get a nice bed and a wooden chair and that's it? So what is the balance? And you can start hearing about it when you talk about the use of ethics and arguments. And let me give you sort of a really good example. Some of you may or may not know about something called the Affordable Care Act in the United States. It was called Obamacare. And here's the scenario that sort of played out. In the United States, some people are insured and other people aren't. So if you are 65 years of age and over, you get Medicare, which is sort of like universal health care. If you are on welfare, well, if you're on welfare, you don't get it. But if you're on less than welfare, then you can qualify for some support, healthcare. If you're a child, you get some qualified support. But if you're just a regular person, you have to buy your own insurance. So the issue that people have is, okay, do I make my own choice and buy insurance, or do I go without insurance? So then insurance companies, you can imagine, they're out there to make money and make a profit. And so they charge you a fair bit of money for your insurance coverage. Even in Canada, it's the same thing. If you're not considered to be eligible for OHIP, Ontario, you have to buy supplemental healthcare insurance. So it's all over. It's not just simply US. But here's another thing. So a lot of people couldn't afford healthcare or didn't want it. So they just didn't do it. So if they got sick or in an emergency, they went to the hospital and they were expected to pay cash on the barrelhead. Because hospitals could, in theory, say, not going to do it. You know, it's too bad, so sad. I'm sorry you're bleeding, but, you know, out next. So many years ago, a president said, passed a law that said if you were in an emergency situation, a hospital cannot refuse to treat you. So that was the exception. So what happened is many hospitals, and I know because I did consulting with hospitals in the US, and they said, well, a patient was picked up in Boston, because I did some consulting work in the Boston area hospitals, and you know, the ambulance would phone around and say, we got a patient in the back unconscious and we need to, you know, can I bring him to your hospital? And they said, does he have insurance? And they say, I don't know. So people would say, okay, we'll bring him here. And they determine if they had insurance. If they didn't, they kind of revive them, give them life-sustaining therapy, and then sent them on their way. But they didn't fix the problem necessarily. So they said, well, that's not right. We ought to do things. And so what happened was hospitals said, in order for us to be a caring organization, we needed to treat people who don't have insurance. And so what would happen is people would take advantage of it and they would go to hospitals without insurance and expect treatment. And so then the only way that a hospital could afford to do that was that they had to jack up the rates for the people who were insured. And the insurance companies are going, wait a minute, that's not fair, right? You can't do that. And the people who all of a sudden their insurance rates went way up, even though they didn't use it because all these uninsured people were using healthcare, they thought that doesn't work. So the United States government, under the Affordable Care Act, said, listen, we're going to require every person in the US to have health insurance. And if you don't, you're going to be fined. And we're going to make sure that the health insurance that's available in the market meets a minimum standard. And there are a significant minority of people in the US who are absolutely angry about this forced insurance. But the reason why the government brought this in, and not a universal healthcare plan, but brought in this mandated insurance, was because people were, in theory, taking advantage of organizations and insurance companies were being harmed. It wasn't because it was a good thing to do necessarily for the patients. It was because the impact it had on businesses. So healthcare is a commodity, and there's nothing wrong whatsoever with an organization to make money. There's nothing wrong whatsoever for an organization to expect fair compensation for the work that they do. There's nothing wrong if you are a dentist or a pharmacist, that all the hard work you put in, the years of sacrifice, nothing is wrong with you expecting to be compensated fairly for this. Nothing. And that's part of the trust. Because if you are working in a healthcare position and you're being asked to do a ton of stuff and you're not being well compensated for it, you're going to be upset. You're not going to trust. You're going to think that people are taking advantage of you, and suddenly there's an erosion of trust. So business and organizational ethics, you know, we could probably have an entire course just on that alone, but I want to sort of bring this full circle and talk about the fact that we have ethics that are patient-doctor related, and we have ethics that are organization-doctor, and ethics that are doctor-to-doctor. We have ethics that are patient-to-organization. And what is it that is a common theme here? It's this idea of trust. And so whenever you look at a healthcare situation, an ethical issue, you sort of say, well, what is it that is a trusting thing to do? And to sort of build on the basis of. And if two people are not able to trust each other, then you start getting into the contractual models, and there's nothing wrong with it. Or if the physician is predisposed not to trust the patient, then you get into the paternalistic model. If you get into the patient demanding things at the expense of the ethics of you get into the agency model. So it's a lot of things get bumped into each other. There are two videos here that I'll let you watch on your own, and it's from a CEO of a manufacturer that made bacon and meat products, and they had a problem. And what you're going to see is that the CEO made a clear statement that he was going to act with accountability and transparency. Just in other words, to act in ways that you can look and say that was trustworthy what he did, that I therefore believe, and therefore it's trustworthy. because you think in terms of even politics, whether you're a fan of President Modi or not, ultimately it boils down to a little bit about trust, isn't it? So what did we learn today? We learned ethical models. We learned how organizations, okay, sorry about that. And then we looked to see how what's best for the organization, best for clinicians, for staff, for patient, and even for family members. So we're going to have Success Week next week, yay. And then we're going to look at the instructional plan, okay? So I'm going to stop share and I'm going to turn back to you and say it's 11:06 and now we're into the office hour time. And give you an opportunity to sort of talk about what you saw today. If you're comfortable with all the things that went on, then you can certainly leave, but I will give people now an opportunity to have a conversation with me about the stuff that we've talked about today. All right. So for those of you who are excited about the opportunity to leave, I wish you Sasri Akal and enjoy next week. For those who are interested in staying and chatting, I'm certainly going to be here for as long as you want to stay and chat. Okay.
Thank you, Professor.
Thank you, Professor.
So
Thank
I
you.
will, good, thank you. So I'll close my eyes and so I won't see anybody leaving in case you're worried that you're going to insult me by leaving.
Thank you, Professor.
Thank you, Professor.
Have a good rest of the week, Professor, and happy Canada Day in advance.
Yes, thank you. Hopefully,
Thank you, Professor.
yes,
Happy Canada Day in advance, Professor.
you as well, Ruby.
Thank you.